Welcome to Fuller Butz, a behind-the-scenes plastic surgery podcast. Yes, you heard that right. Join your co-hosts, Dr. Sam Fuller and Dr. Dan Butz, board-certified plastic and reconstructive surgeons on an exclusive full-access pass into the world of plastic surgery. Combining their expertise and training, Doctors Fuller and Butz will share medical insights, detailed explanations, and lighthearted humor to keep you entertained and informed. We're certain you'll become passionate about the plastic surgery specialty, and between debunking myths, uncovering truths, or just making you laugh out loud at their perspective on this creative and artistic field, we've got something for everyone. From tummy tucks to Botox and mommy makeovers to surgery do-overs, the Fuller Butz podcast will surely satisfy your podcast fix.
Hello, and welcome to the Fuller Butz podcast, behind-the-scenes podcast of plastic surgery. I am Dr. Daniel Butz, and joining me as always is Dr. Sam Fuller. How are you doing today, Sam?
Doing great. I'm excited that you got through the intro without messing up some of it. It was hanging on by a thread, but we got through it. Another episode of the Fuller Butz podcast is upon us, and excited to talk about this specific topic.
Yeah, you seem to be, you won't stop talking about chicken nuggets lately.
I feel like there is, it's like COVID over here with chicken nuggets.
They're everywhere.
It's a pandemic. Patients are coming in by the droves requesting to have their chicken nuggets removed. And so I promised the last one.
You need to tell us what chicken nugget is.
We will discuss the chicken nugget in a full episode on the Fuller Butz podcast. And I think it's a great topic because it's timely and it's actually way more common that, as it's been brought up, I feel like I'm seeing it, hearing about it, being able to correct it much more now than ever. So the chicken nugget, Dan, do you want to go through and tell our audience what the heck are we talking about?
So sometimes, a lot of times when patients are talking about breast enhancements, whether it's reduction, lift, augmentation, they frequently will kind of grab this little piece of skin or fullness. Sometimes it's smaller, sometimes big, and say, I just hate this. What can I do about it?
For our audio listeners only, can you describe where you're grabbing?
It's kind of the right in front of the armpit, kind of that transition zone. It's really, if you put on a sports bra, kind of what's poking out above or kind of to the side of that strap. And it can be a challenging issue, right? Because there's different things that could be going on there. It could be, some fatty tissue. It could be actual breast tissue, glandular tissue that can be quite dense. And there can be a component of loose skin. So how do you kind of evaluate that when a patient talks to you about their chicken nugget?
Yeah, it's important to take the full patient history. So taking into account their age, their breast size, their goals, and then physical exam is crucial, whether it's a chicken nugget or a chicken leg or chicken thigh or whatever. But you really need to assess the soft tissue. So that includes the skin as well as the volume that's below that. And so if the patient is younger, has good skin elasticity, they have some very, fatty feeling tissue, they may be amenable to one treatment versus another. But if things look like it's an accessory breast tissue, it's very firm, nodular, is consistent with breast tissue, then I think that sort of leads us to different ways of thinking. I also try to understand, does the breast volume in that area that's hanging out just by their armpit, does it change based on the time of the month? Has it changed with their weight loss journey, their weight changes? How is that impacting them? Because that's going to impact what we can offer to them, as well as, what surgery we're doing. Are we just doing a breast augmentation in which the incision's nowhere near that? Is it a breast reduction where it could potentially be treated from, the incision that is already made for that? And so those are some of the key points that I think about, consider, discuss openly with my patients. What did I miss? What happens in your clinic?
Yeah, no, same. I think for the vast majority of patients, we're mostly talking about liposuction of the area. Obviously, there are other treatment options for, larger deformities with more skin laxity. But if it feels soft, the skin elasticity seems reasonable, liposuction is often a good place to start to try to, remove some of that volume. But like we've talked about with previous liposuction, topics, liposuction does have limitations, primarily, potential for more skin laxity present. So I always kind of try to, set realistic expectations. Like we can defat it, but a bra might still push loose skin up or down. a little bit, but normally it's a lot better than before. What about you? How do you talk to patients about that?
Yeah, the same. Really try to hone in on what bothers them and how much it bothers them. Does it bother them enough where they'd rather have a scar or an incision to directly excise? Because that certainly, to me, is a more definitive treatment of tightening the skin and directly excising the tissue, especially in those circumstances where the tissue that is at hand is very fibrous, glandular in nature, and is not amenable to liposuction, which really works better with just gross fat as opposed to the more rubbery tissue that's there. And so just talking through them what those pros and cons are, and anticipating that there may always be a little pinch of skin there, even if it's tightened, and kind of going through the risk reward pros and cons of either liposuction alone versus the direct excision, which typically we can hide, in the armpit and in a relaxed contention line, but may be better for certain patients than others.
Why don't you describe what breast tissue looks like compared to fatty tissue actually when you're looking at it? Because I think a lot of people think probably the breast is often very soft and fatty like. What does that mean? Kind of, was it when you're looking at, let's say, a breast reduction, you can really differentiate those different layers?
Yeah, fat is fascinating because there's so many different types of fat just based on the layer, the location. Um, you know, the subcutaneous or fat that's sort of below the skin is a bright yellow, sort of globular, very soft, something that's does not have a robust blood supply or strength to it. Typically is amenable to directly excising fairly easily. Liposuction tends to really allow that to be aspirated and removed. As you get further deeper into, especially for some patients who have very dense breasts, you start entering into the breast tissue itself, which is fatty, but also has multiple soft tissue components and connective tissue that changes it from just being a nice yellow homogeneous color to white and yellow and rubbery and firm, and your dissection devices, your electrocautery, your bovie is just not always going through those as easily. There may be more blood vessels, more dense, and what's really interesting, as we learned as we both went to the same training program, is that sometimes the fat changes as it enters near a blood vessel where it can change a different consistency. And then sometimes as we're dissecting, getting closer into where the armpit is or lateral breast, you think you're done. And then you sort of hit this like second wave of tissue, which is like an accessory breast tissue or something that's almost like a second breast. And a lot of patients have coined it that, or said, yeah, I've always had a second breast up there and it runs in my family. I got 4 boobs and, that sort of thing. And so while that's playful, it is, great to listen to the patients as you're sort of understanding what plagues them and what bothers them. And it is sometimes like a second breast reduction where you think you're done and you have all this other extra stuff that's there. Fat is not fat. There's different types to that. Sometimes even with gynecomastia, I know we talked about a case about this, more recently. You may expect or anticipate it to be different, just based on your exam. And it's good to have lifeboats and backup plans and plan, B's and C's. But that's my perspective on trying to explain fat to you.
Yeah. No, I mean, I think that's it always is kind of mind-boggling. Like, you go in and so it's just like the liposuction. Sometimes you go in and it's like the fat just pours out and like it's super easy to contour. And sometimes it's like you're going through concrete and it's a lot more work to get that fat out. Same thing with the breast. Yeah, so sometimes if it feels nice and soft, it's like, yeah, we can just liposuction it out. But if it feels a little more dense, like maybe you can get it out, but maybe it might be a little bit less dramatic with just liposuction. So everyone's different. As we age, breast tissue tends to become less dense and become more fatty with hormonal changes. Sometimes you'll be doing a breast reduction and it's like you can just see this perfect layer of fat and then just solid white glandular tissue that's super firm and just all dense breast tissue. So it's pretty interesting, and everyone's a little bit different. You can't always predict how it's going to be based on the exam, and having those different tools at your disposal and different ways of managing that is really important.
And that different type of fat really impacts surgical flow. Like if some of it is just it's almost like paint by number, like the breast reduction, it may save me 30, 45 minutes because it's just easy planes and it
Yeah.
just comes right out. It's almost like the body saying, hey, this is where you should cut and remove. And then other times where things are, so glandular, so firm, you're really sort of like fighting the tissue almost to make sure that you're getting the correct planes and battling that blood supply issue as always, as we do as plastic surgeons. It's interesting.
I think we digressed from our chicken nuggets, though. But I think that it is pretty interesting to for people to kind of understand that it is all a little bit different. So when would you consider doing like an actual skin excision?
So if the
Or gland skin excision.
if the patient has very redundant excess skin, if there's lots of skin that the patient does not like, if the tissue is voluminous or appears to be in that fibro layer of fatty tissue where it may not be amenable to liposuction, and if the patient would not mind a scar or an extra incision, those would be perfect candidates to talk about that with. Oftentimes I'm taking a marker, having them lift their arm up and down several times, showing them, actually grabbing that chicken nugget, kind of showing them that's the area that I see, is that what they see, marking out typically it's not an incision, it's sort of a wedge, and it's almost like a lemon wedge. And so it's an ellipse that is excised in order to remove skin, not just making a cut to cut the fat out and leave extra skin. And we cut that out and close it. And then I'll actually have them look in the mirror, open it up so they can see where that proposed incision would be to make sure that they're comfortable with that. But if they're raising their arm, they're doing the YMCA, they're high-fiving, that scar may be visible, as other armpit, sentinel lymph node biopsies and other scars may or may not be present that's there. They tend to fade nicely. But other times patients really don't like it. And I'm showing them an incision that goes across the armpit all the way up into something that's very visible. And then, oftentimes they say that that's not worth it. And, just to try to get as much out as you can with lipo or so forth. I don't know. What are your thoughts?
Yeah, I think that's a great approach. I mean, you just got to be, patients need to be fully aware that to get the things as tight as possible, a scar is going to be required, and where that scar is going to be. And a lot of clothing will cover it up, but a lot of swimsuits and tank tops and things probably won't. And I've probably only done a handful of skin excisions there, and lipo quite often there. What about yourself? What would you say your percentage or breakdown is for excision versus lipo?
It's 50-50, I would say.
Is that right?
Yeah, I feel like a lot of patients with very loose skin complain about it. And, depending on how I can hide the incision or scar, they think it's worth it. I certainly tell them there's a bigger bang for the buck. I can not guarantee, but I can definitely provide a much more dramatic, oftentimes with the skin redundancies by cutting that out. But other times with younger patients, very elastic skin, I'm sort of ushering or pushing them like, hey, we can just do this with lipo.
Yeah.
Let's not make a scar. And I would say the same thing is for like lateral breast tissue. So the tissue that's below the armpit, kind of extending from the lateral portion of the breast around to the back. That's a common kind of combo area where, patients don't like that. And in combination with like an augpexy or augmentation with the lift, that's something that's considered for lipo as well. I'm not sure if you're talking about or kind of accentuating that during those procedures as well, but try to decrease the volume that they don't like.
During a reduction, I almost always lipo the lateral chest unless there's like nothing there. With augs or lifts, it's kind of more of an optional kind of add on, but certainly if there's fullness there, they don't like that. It can make the breasts look a bit better because all of a sudden it doesn't have that lateral fullness. It's kind of, making everything look wider. So kind of give more definition and contour to the side.
And typically, that add-on comes with an additional charge. It's more procedural time. It's oftentimes if I'm doing an augmentation with the lift, there's no liposuction equipment that I would otherwise use. And so that comes with an additional cost. And so patients are aware of that and they can kind of choose. I would say, the breakdown is, can it be done with lipo? Can it be done with direct excision? And then what the cost is. And then, really the patient can determine how worth it is it based on, do they want an additional scar? Do they want to live with it? Is it worth the cost? And, just want to guide them and provide them with as much information as possible.
Do you do anything different for recovery for that? If someone's doing a augmentation, do liposuction there versus a skin excision? It's kind of a tough area to get compression on.
I don't. I just tell them it's going to be swollen and it's going to hurt.
Right. Yeah.
So just be prepared for that. I've had some patients who that was the only spot that was sore or tender. And, there's nerves and there's tissues that are crossing over there. It's not as well compressed and supported as other parts of it. That's usually where I encourage them to put an ice pack anyways, sort of along the collarbone or, armpit anyways, but it's not major, but I would say, you're going to notice that we were
swell,
over there.
bruises a touch. Yeah. Mm-hmm. Doesn't really change, doesn't increase the length of recovery or anything like that, which is always nice for those add-on things, not to make it a worse experience.
No, and I would say that it's for such a small little thing like the chicken nugget that we've kind of joked about and coined, if you will, it's almost like an overemphasized satisfaction with that. Like the patients love that not being there anymore. It's almost like this little thorn in their side or their armpit that was always there, they never liked, and may just take us 10 minutes to do or that, but it tends to have a very dramatic lasting satisfaction rate. So it's one of these small interventions that can lead to really happy outcomes, sort of outside of what you would expect the amount of surgical time and all the work that you're doing. It seems like patients are really happy with it.
Maybe the pandemic will spread to Milwaukee soon. Definitely comes up, but it hasn't been overwhelming, a big wave.
Yeah. Well, we're always looking for new topics on the podcast. Can't keep talking about the internal bra every time, so we have to mix it up. Do you, for your breast reductions, feel comfortable if patients are not happy with that, just getting through that through your breast reduction incision, like exploring up there, or do you make a counter incision or an additional incision?
I mean, if there's glandular tissue up there, I think you certainly could potentially get that out. I don't think I've ever actually had to chase it out that high. I often will liposuction up there with the reduction. I don't know if you'd be crazy about excising skin there, though. You worry about blood supply to obviously that lower T incision, but liposuction up there is fairly common with the lateral chest, and others do a little bit up top. I don't think that compromises things too much. What about you? Have you excised tissue through that lower incision with the reduction?
I have, actually more recently I did one in particular where, I'd sort of direct excise the lateral breast tissue as well as that axillary tail, or that tissue that kind of extended up towards the armpit, just because the flap went that way. I think lipo is probably a much more common and very feasible way to do that. Typically, if you need a breast reduction, that tissue is amenable to some liposuction commonly. This was just one where it needed to be directly excised as well, so it worked out nicely. But I agree, not making an additional incision or having a second mark, a cut over there. We can just use the appropriate breast reduction incisions that we already use.
Awesome. Yeah, I think that's a good overview of that, and just a good refresher that it is an option. It's pretty easy to add on. Doesn't really add too much to the recovery, and can be again a really nice. Just makes everything look more cohesive and gets rid of that kind of trouble, that thorn in their armpit or nugget. So, yeah, great second episode of season 3. It's hard to believe we're back at it after a pretty long break, but we'll keep coming up with more here, and we'll talk soon.
More nuggets of knowledge coming your way. Thanks for listening. Talk to you guys later.
See ya.
Thanks so much for tuning into this week's episode of Fuller Butz, a behind-the-scenes plastic surgery podcast. Doctors Fuller and Butz are so appreciative of your time and attention. We invite you to subscribe, share, and continue to enjoy our plastic surgery perspective. Feel free to reach out on Instagram at either @SFullerSurgeryMD or @DanielButzMD. That's Butz with a Z, for comments, suggestions, and support. Remember, be artsy, stay scientific, and make life fun. We hope you'll join us again on the next episode of Fuller Butz.